Well, welcome back to Not Alone with Melissa Sue. Like always, I'd like to start with a few grounded breaths. So if you could place one hand on your heart, one hand on your belly, we're going to take a slow inhale through the nose and a long exhale through the nose. Let's do that a few more times. Inhale through the nose and a long exhale. I always love to start with a breath. It grounds me, it grounds my audience for the information that we're going to share today because my podcast is sharing truth. I'm a truth seeker. I'm also sharing personal stories because you never know who on the other side might feel alone and doesn't know who to trust for resources. Ever since my husband died, who was a dentist, by suicide in 2022, I asked myself, why? And before that, I did all the work myself. I knew I had to heal myself. And as I did, I started my podcast to share other people's stories because once I shared mine through my books, it allowed others to not feel alone and speak a truth for them as well. And so this is also what it opened up to me was the world of biological dentistry. And I've been blessed by being connected by so many wonderful biological dentists. And it opened up the door to educate you as the listener about your oral health because each tooth is connected to an organ. And it's so vital to start looking in the mouth first. And each dentist that I have on will give you that empowerment to make those choices yourself now. So get educated. So this is why I have the honor today to have Dr. Seb all the way from the UK here today to share his story as to how he became a biological dentist, his own health journey, but also what he provides for his patients today, how he's able to treat patients today. So welcome, Dr. Seb.
Oh, what an inspirational podcast and journey you've been on. And I'm just so grateful you being so raw and honest and vulnerable with your audience because that's huge. And it's obviously, you've seen me online. It's what I do with my clients and patients too. You're just 100% yourself, 100% natural, and just giving all the information that you have. And that changes week by week and day by day, as we know, right? But we can
Yes,
give you the best of our knowledge right now.
exactly. And once you see the truth, you can't unsee it, right?
No, you
And
can't.
that's why I'm so grounded in knowing what I saw, first of all, with my own husband as a dental hygienist for 17 years and connecting the dots. And so I'm just so curious what I've seen now by interviewing other dentists and specifically biological dentists. There's always a pivotal moment in their lives that created that shift. Either something happened to them personally, or they saw it to a loved one or a patient, and then they had to create that shift. So I'd love to learn your journey because I think
Mm.
I wrote down here, I read that you originally believed natural medicine didn't work.
Yes, I was indoctrinated.
So tell me of that part of Dr. Seb where you thought natural medicine didn't work and how your health journey shifted that.
Well, it's a bit of a story. So I guess we'll start with my favorite saying, which is persistence beats resistance. And I was, uh, I guess my family dynamics within my system when being younger was my dad was very focused on my sports achievements. My mum was very focused on my academia achievements. So the cauldron pot of that really made me try and excel in everything. And of course, it can go the other way, right? Because my brother lost his ability to excel because he didn't like the feedback that he was getting in our internal family system. So it's interesting how you reflect on these things as an adult. But it led me being very good at science. I fell in love with science for some reason. And from an early age, I wanted to do dentistry. And it just came from my mum saying, well, if you're good at science, you could be a doctor, you could be a dentist, you could be a scientist. And then I went to work experience in a dental practice. And this was back in the day where you didn't need any qualifications to nurse or anything. You could just go in and assist the dentist, and they would really be guiding you on Saturdays. And I was working on reception, and I did that I think I started like when I was 13, 14, and I
Wow.
finished when I was maybe like 17. And I stopped doing that nursing and that reception work because I didn't get into the grades in the UK to get into dental school first time round. And at the same time, because I was so focused on my sports, I did all the sports as a kid, but as I got older and I was more focused, I ended up playing football or soccer. Football we can call it now. You guys have realised what football is, the World Cup being in America,
Oh,
eh?
yes.
Although we won't talk about the England game.
Oh, fun. Okay. Love it.
and then, and then so football and boxing, and I actually lost. So I was ranked fourth in the UK for my weight division at
Wow.
the time, and I lost the fight in the semi-finals of the nationals of the UK. That if I had won, I would have been in the 2012 Olympic training camp, and this was back in 20 end of 2010. So then I looked at it. I was like, right, my grades aren't good enough to get into dental school. My sports, I'm on the precipice, but I'm not quite good enough. I've got to make a decision here. Where do I go? What do I do? And I decided to focus on my grades. So I resat my whole second year. In England, we call it A levels. It's just before, it's college really in England, but it's not university. It's like the 2 years before college,
We have
university in
that in
the
Quebec City. It's called CEGEP. So yeah.
UK. There you
Yes.
go. So you guys would know more than most.
Yes.
And I was like, okay, well, I'll resit my exams. Anyway, the irony is I stopped the professional or the semi-professional boxing, and I did my exams, and I still didn't get the grades to get into dental university because it's crazy, crazy hard in the UK as it is in America, I'm sure. And I thought, oh, maybe it was just about the money. Maybe I just wanted to earn lots of money. So I thought, okay, what was my worst grade? And I went to university to study my worst grade, which was chemistry. And chemistry, because chemistry was just one of those things that didn't click. So I was like, right, if I go to
It didn't click
university,
for me either. I didn't like that class
oh,
either.
so hard.
It was.
So I went to undergraduate and I came out with a first in chemistry at the end of the 3 years. And I was like, oh, I can't be bothered to go and do another 4 years of dentistry. Let's just go to London, go on a graduate scheme, earn good money. And I went and joined Fujitsu Services. They're a bit like IBM, probably, but you guys would know. And was on their sales and graduate scheme. And I was 2 year graduate program, and every 6 months you get graded, and I was outstanding at everything. At the end of it, I qualified from their graduate scheme as a super graduate, and they gave me all this extra money, all these bonuses, and all this stuff. But I hated my life, and I just really didn't enjoy anything. And at the time, before I started this graduate scheme, I went traveling around South America, and I got really ill in South America, and I did Brazil, Argentina, and Bolivia. And when I was in La Paz in Bolivia, I ended up intensive care. I
Oh,
had pulmonary, well, I had severe altitude sickness, which led to pulmonary edema, which led to a heart murmur. And then I was coughing up blood, couldn't make my flight, collapsed at the airport, and no one could find me because my phone got stolen when I collapsed. It was
wow.
an iPhone back then. And so in the end, my mum and dad managed to get through to American Airlines, and they found me in this hospital, this airport hospital. And the UK embassy came and rescued me, and they took me down to another hospital, and I was there for a week on oxygen and antibiotics and all these crazy things. And on the back of that, when I came back to the UK and I started this graduate scheme, which is where I met my wife, right? So I just spent 3 years of studying pharmacology, biochemistry, understanding how everything interacts in the system, but not learning how natural things interact, only pharmacy, right? So that's when I was indoctrinated with only understanding how pharmacy could help us. And during this journey of my own, I couldn't, basically nowadays, it's, SIBO is probably like what I had back then, because I was having antibiotics, antifungals, antiparasitics, and I had like I think it was 6 courses in 9 months,
Wow.
and of different antibiotics, antifungals, antiparasitics, because they couldn't diagnose me with anything. Tropical disease center couldn't find anything. No one could find out what was going on. This led me really depressed, and I was like, how can my life be like this? And I'm doing so well at the graduate scheme, but I have no energy for socializing. I have no energy for my other half. I was getting home, going to bed just so I could get up and go to work the next day. It was like this crazy loop that I was stuck in. And at the same time, my wife at that point developed health anxiety as well, because she was the classic orthodontic extraction case when she was younger. And I've seen photos there. She had a lovely wide dental arch, and they took 4 premolars out and retraction. And she had head, neck, shoulder problems, TMD, basically airway collapse now is what we call it, right? She was having all these ergonomic mouses. This is back from the day. These ergonomic mouses, all these special computer desk things, and sitting in the right places, and still having all these like horrible symptoms and anxiety. Um, so she was going through what we now call the airway journey, and I was going through the microbiome journey at that
Mhm.
time. But I was doing it for functional medicine and practitioner, and she was going through no one being able to help her in the UK, right? Because this was like 15 years ago. And she found a guy, and he was like, "Oh yeah, well, you can use splints to release the jaw, and then we'll have to do jaw surgery. It didn't feel right." Went to another guy. "Oh, we can use the ALF. We can expand this." And she just like broke down in the chair, crying, be like, "Yeah, this is literally what I feel like I need intuitively after researching like all the Reddit forums and what the guys in America are doing, because we're typically in the UK we're kind of behind the times, I would say,
Yes,
in terms of
yes.
biological dentistry. And so she had that journey. I was going through the cleansing and restoring of the microbiome, and changing my gut environment and getting better every like week. But during this journey, I met an immunologist because I had private medical care, luckily. And he wrote a book, and he was like, he must have been in his 80s when I first met him. He's like, what are you doing with your life? And I said, "Oh, I'm in this graduate scheme in London." And he said, "Well, did you want to do that?" He was like, "Do you enjoy it?" I was like, "No, really, the only day I look forward to is payday." And he was like, "Okay, well, what did you want to do?" And I said, "Well, I wanted to be a dentist when I was a kid." And I said, "I couldn't tell you why I wanted to be a dentist, just always knew I wanted to be a dentist." And he was like, "Okay, well, let me put you in contact with King's College London entry programs." And there's only 5 universities in the UK that do an accelerated program for people that have already done undergraduates that are accepted. And we worked out that I couldn't afford to live and rent in London and be a student again, and well, on my wife's salary. So we moved up north to, which is where she's from, to Manchester in the UK. And I studied at an accelerated program, which basically in the UK you do the first 2 years in one, which is all the theory, all the knowledge, all of the like practicing on dummy heads and stuff. And then the last 3 years you're working in the NHS. You're working in all these deprived areas in Accrington, Burnley, I don't know, Accrington, Burnley, Carlisle, um, yeah, Morecambe, these really deprived areas. And it was great experience because they needed the dental care, and we were guided by all our professors, which is rare because in the UK you work in dental hospitals and you only get filtered in patients who've already been seen by other clinicians. So it's a very new thinking. It's more like an apprenticeship for dentists, which makes sense, right? Because
Right.
you are actually doing dentistry day in, day out. So honing your skills. So, but at the same time I was learning the normal dental route, I knew that functional medicine had helped me and got me back to my best, if not better. So I wanted to do functional dentistry, which I thought it was called then, right? But then I realized there was no practitioners in the UK doing this. Holistic dentistry was not a thing. Biological dentistry, that I don't know how, there was no term back then. And so I shadowed the guy that was doing my wife's braces to learn the airway expansion aspect from the ALF's perspective. And then I went to another guy that I'd heard of which is the clinic I own now, which is so funny how it works. But and I went to him, and he wouldn't answer the phone. He was so busy all the time, obviously, because there's not many biological dentists. Just didn't respond to me, didn't get back to me. And then one evening when I was at my wife's dentist, he was in the waiting room, and he
Wow.
introduced himself, and I said, "That is so crazy." So
Wow,
anyway,
divine intervention there. Yeah.
so I started shadowing and waiting and learning from him, and then he took me straight into biological dentistry. So in the UK, you're meant to do an NHS foundation junior doctor year. I was like, no, that does not make sense to me. I don't feel aligned with that. I'm not going to be placing amalgams in people. I barely did any during my undergraduate either. And I just went straight into holistic dentistry of what knowledge he had anyway. And then obviously it's a big learning curve, which I'm sure we'll come on to because there's so many aspects to it. And the clinic was not set up for the full remit of biological dentistry that we know now. But since I've taken it on the last 3 years, we've made sure that we're like the most incorporating practice for biological dentistry that that patients come to us and we do all aspects of it, not just one area, and trying to get specialists in to support in all aspects because it's such a minefield, isn't it?
It
So
is.
yeah,
And it's so hard
bit of a
probably
joke.
for you when you first started like that. Like you said, if you were kind of the only one other than this other dentist that you shadowed. So did you
Yeah.
find that hard to start off, just even from other colleagues, from general
Oh God.
dentists?
I took the during my undergraduate study, I did my dissertation on coconut oil pulling and the benefits of it, and I just got like completely failed, and they laughed at me, and they didn't understand the evidence, didn't say it was any good, and so I was like, you know what? I that hurt a lot from my perspective, even though when my colleague read my whole dissertation, she was like, "This is incredible. How can they fail you for this?" And I said at that point that I'm just going to focus on patients and what
Mm.
I think I can deliver to them. So that I lost the noise from the other professionals within the UK because I was one of the only to start doing this in a wholesome, complete way. And I said, right, I'm going to look to America, I'm going to look to Australia, I'm going to look to Switzerland, I'm going to look to Germany, and I'm going to go and shadow all these top dentists and learn from all these courses and bring it to the UK so we can have this complete ecosystem.
Mm.
So I spent, and obviously every day is a school day and I'm still learning now, but I spent the first element of my career learning airway expansion, orthopedic orthodontics, homeoblock, cranial decompression, splint work, TMD work, bite alignment. And then after that, I was like hearing about Dr. Dome in Germany and being like, oh gosh, yeah, there's cavitations and there's root canals. I was like, okay, really got to hone in on surgery, but there's no one in the UK doing cavitation work. There was one guy that I can find, a German guy in the south, which is on the coast down south, and I spent 10 months going down, learning, shadowing, cleaning out the jawbone with him. You know, and he was doing it manually. So he was going into these cavitation areas manually, no rotary equipment, no nothing,
Wow.
cleaning them all out. And then so I thought that was cavitations. Then I went to Munich and started learning, oh no, you can use piezo, you can use ceramic burrs, you can use this, you can use that, you can use ozone. He was using ozone, to be fair. And I was like, wow. And then I was like, right, I've got to learn ceramic implantology because I don't want to be putting metals in my patient's mouth. So then had to go to Switzerland in implantology. And then now that was all before I got the clinic. And then when I got the clinic, it's like, oh my gosh, there's only me on this clinic and a therapist and a hygienist. I've got to get more dentists, but of course that takes time, right? And
Right.
then I'm only at the point now where I've just got enough clinicians in to help me out, and I can start specializing in the areas that I want to,
Okay.
which for me is definitely this neurocranial decompression plus the big surgeries as and when needed. But um, one thing I didn't start with there is because didn't mention there is because when I went from university straight into holistic dentistry, I wanted to start from the beginning. And the first thing I learned was breathing, like you just did at the beginning of this thing.
Yes.
Buteyko breathing, specifically nasal breathing, unless you're in a fight or flight moment, and myofunctional therapy to improve the biomechanics of breathing, right?
Yes.
And that I found because I wasn't doing all this big, crazy, fancy cavitation, ceramic implants, root canal removals. I found that I could make such a huge impact in my patients' lives, kids and adults, kids to grow better and breathe better and be more focused and not, ADHD and all over the place and not sleeping and waking up all the time. Adults just to be present and to actually like live in their life and feel grateful. And I noticed that a lot of their symptoms that they had, and they were thinking, oh, it was the mercury fillings, it was this and that. Before we even did that big, more expensive stuff, we just got them doing breathing exercises for 3 months and mechanical stuff, biomechanical muscular tension and releases. It made a huge impact. So I thought that was, and that's why when new patients now come to see me, one of my sayings to them is like, you don't know what percentage that is going. So I always say you've got a line of symptoms, right? And you go through day to day like this. And when you go over this line, you get symptoms. And now we want to take a chunk out of down here so you can operate down here again. However, how am I meant to know if that's the mercury, if that's the breathing, if that's the depth of sleep, if that's the root canal and failed root canals or the inflammation within jawbone? So I always say you start with the easy, low hanging fruit, least invasive, reversible, least expensive things. And then you build up to the more advanced stuff later. Because I had that initial look at, dentistry where I was like, we're just doing breathing and mechanics to start with. Because it made such an impact. That's where I start with most of my patients now and only build up if I need to,
Yeah,
which I
I
just
love
find.
that. I love that you start because breath is the most important, right? The quality of our breath. And how I dove into that was my son. I got into Airway when he was really little. I'm still working with him alongside. It's been a long journey, but he was my teacher in Airway. And we brought that to our dental practice in Wasilla. So I love that you start with that, because even you mentioned your wife with anxiety. People don't realize that anxiety could be your airway. So I'd love to go back and kind of focus on that, because I know you talk a lot about that, especially with babies. If a parent is listening right now, has a newborn, there's so many things they can learn right away from their baby's mouth. Like, for example, if they're not latching on, so many moms, they think, oh my gosh, it's me. I'm doing something wrong, or, they're not latching on. Whereas it could be a tongue tie, it could be a lip tie, it could be so many things. And I've been curious, once you dive into tongue ties, lip ties, my belief is that it's a wound up nervous system. They, like, in vitro, the baby will kind of mimic the mom's nervous system or the surrounding nervous system. And then they're born with that. And which oftentimes these tongue ties at birth, it's just a wound up nervous system, or maybe the trauma of the birth too. That could be something. So I'd love for you to just kind of educate people listening, because I was never taught that, even as a dental hygienist. My husband, a dentist. As I gave birth to my kids, my son does have a tongue tie, had a lot of nervous system issues from colic, which I learned later on was all gut issues. And it propelled for me when I was pregnant. I was living in so much fear and just not a very good environment. And so how that has a ripple effect, but how it affects our airway. My son had, even though he slept long hours, was droggy all day. He was kind of more quick to temper, aggressive as a little boy, a lot of screaming and the behavioral issues that would be kind of maybe he's ADHD. But luckily, we met a dentist that talked a lot about airway. And so we went down that road with him. But yeah, I'd
Right.
love to give you the platform now to explain your expertise.
Yeah, I didn't even talk about the tongue tie journey stuff, did I? My mentor that I got the clinic from, he was releasing babies' tongues from probably like 10 years even before I met him. So he was one of the pioneers for laser dentistry within the UK. And this was with the erbium YAG laser, which is like called the water lasers, BioLase, Create-It, and obviously now superseded with the CO2 laser releases in our kind of way of thinking from a dental professional point of view. But I even think, like you say, it starts within utero, when it's the mother's nervous system, the stressful environment, the vitamin K2, I think, is the missing thing. And the vitamin K2, for anyone that doesn't know about that, is like the work that Weston A. Price did 100 years ago, I think it was now, wasn't it? That if he called it activator X, and one of the main reasons he thinks that the indigenous societies, when they left the way that they lived and ate, the downfall for it was the processed foods and the lack of nutrients within the diet. And one of
Yes.
them
Yeah,
was
because it's in our soil, the soil that our food is being grown in, we're not getting the nutrients out of it.
exactly. So supplementing now for vitamin K2, or eating the foods that are high in K2, like cod liver oils and stuff, I think really supports the growth and development and of the baby. But also, here's a crazy one that I've been researching a bit more recently, that obviously with glyphosate that's been introduced into the market in the 1970s, and how it disrupts and kills all of the bugs living in the fields, right? It also does that with all the food that we eat when we're eating non-organic, which we've all done for many years until we found out about it. If mothers are doing that and their mitochondria is dysfunctional because of it, because glyphosate mitochondria is a bug that's living in harmony with our ecosystem. So if we've got dysfunctional mitochondria during pregnancy and our body is not circulating energy and communicating properly because our bug system, our mitochondria is not communicating properly because of the glyphosate, then I think that has a massive change in the baby's apoptosis, which is breaking down, like we all start with webbed fingers. So it's breaking down the tissue in between the fingers, which is same thing for the tongue, same thing for the lip ties as well. And if anyone that doesn't know what a tongue tie is kind of two, and let's circle back to how let's do two types of tongue tie first. One is complete tongue tie. I've got a lot of balloons today, haven't I? Keep coming out. A complete tongue tie is where the tongue is completely attached to the lower jaw, the mandible. It can't move. So it's stuck there. That's the one that even midwives and healthcare visitors understand, and feeding just can't happen. That's true ankyglossia. The other ones, the posterior tongue ties, is where the tongue is too tightly attached to the muscular diaphragm underneath it. So in order for it to move, the diaphragm has to move with it for the tongue to operate normally, which is speaking, swallowing, um, obviously proper breathing as well, with the tongue being in the roof of the mouth. However, when babies are born, I think, like you said, that nervous system, that if they have this posterior version of tongue tie, you can functionally release it with craniosacral therapists, chiropractors that are network spinal, and osteopaths, by working with the fascial systems within the body. And then that will, because some babies can't feed at all, even with a posterior tongue tie, because they realize the tongue can't move with the fascia, and the fascia is pulling on the floor of the mouth muscles, but they're too tight. So there has to be an element of a functional release there that those body workers can help us do. However, there's always going to be some type of compensation for a posterior tongue tie. So because that tongue has to move completely. Sorry, let me categorize it for you. So ankyglossia is 0% movement of the tongue. Posterior tongue tie is an element of movement, but the tongue, floor of the mouth muscles have to move with it, right? So how I categorize it is that however much floor of the mouth compensation there is what, so normal tongue movement should be 60% movement of the tongue before it engages the floor of the mouth or more. So more the better, right? Because it's completely free tongue. I call it like a slight posterior tongue tie when it's between 30% and 60% of movement. And I call it a strong posterior tongue tie when it's 0 to 30% movement. And a tie is still a tie. That fascia is still going to be connected throughout the whole body. But what we do is we functionally release the fascia first, allow the nervous system to calm, use the body workers to get more functional movements, and then we end up releasing the tongue. So then hopefully we're aiming to achieve at least 60% or more movement from that tongue to help the baby feed. Now, obviously the first element is feeding, right? The baby can then feed, the family unit is happy. We're
Because
not
feeding will shape
compensating.
the jaw too, right? The proper facial structure. I mean, back in the day, we used to breastfeed 2 4 years. So it had all this,
Yes.
I went straight to solid foods. And now we go from breastfeeding, very little amount of time because oftentimes mothers have to go back to, work and given all these, just pouches. And so people have to understand the benefits of getting these things addressed early on because it affects,
Yeah.
first of all, their jaw, right? And the
Yeah.
airway that's coming in, because air, like you said, is the most important. So the way that we're breathing, the baby's breathing.
And if we release that tongue, and then that tongue can go back to the breast and it can feed by putting active pressure in the roof of the mouth on the palate, you're pushing actively on the skeletal bone, the maxilla, to influence maximum epigenetic growth for that child, right? So when we get a proper swallow functionally, we unlock epigenetic potential to get as wide as possible for that kid. So then what I say is that if you think about that not happening and you're like, oh, okay, the baby can feed, right? We can bottle feed because we don't have to breastfeed, or there's a posterior tongue tie there, and baby can breastfeed, but there's a lot of mouth breathing going on. Even you notice it as a baby, you say, okay, we don't need it for feeding, but what's the opportunity cost? You say, okay, well, if the tongue is not growing the upper jaw, and the tongue is low, the jaw comes down, it traps the lower jaw back, the tongue blocks the airway when we sleep, crowding comes in, we get dental decay because we're clenching, grounding, mouth breathing, and we're in this cascading effect of all this dental work. And then the risk factor then for all this additional dentistry that happens to that child is impacting the body from a biochemical point of view, because they're having all these extra materials within the mouth that could disrupt the nervous system, the endocrine system, the regulating breathing system. And we know now that if the tongue is not biomechanically in the roof of the mouth and it stays there while we sleep, we don't stay in deep sleep as much. Our lymphatic system doesn't kick in. Our brain does not shrink 60%. We do not flush all the toxins away. And then we get all of those things like we were talking about: ADD, ADHD, depression, anxiety. Because I say to my patients, that adult patients that have got these issues, we start with the myofunctional therapy first, because you're anxious, I believe, because your airway collapses at nighttime, and the only way for your airway to open is your autonomic nervous system sending a signal to either clench, grind, open your mouth, or protrude your jaw forward. Now, if your body's having to do this lots of times at nighttime, it is activating the fight or flight nervous system all the time. So then you're predetermined in the day to be more fight or flight than you are meant to be more rest and digest. So when you're more fight and flight, not only is your body more anxious, but you're more reactive to things. You're more likely to get cold, blah, blah, blah. It's just a never ending story, isn't it?
Yes. Yeah, it's so true. It's just people come to realize that they're breathing the quality of the oxygen. I see it all the time now. I can't unsee it as well, right? The shape of their jaws and or the bags, the little kids that have so many bags under their eyes and how important to find a provider that does airway early on, or if a mother is having a hard time with a baby latching, that could be something that they could look into. Find a provider that is knowledgeable with babies doing the craniosacral adjustment, doing the myofacial therapy. That's kind of what I'm doing with my son too, is my myofacial therapy, the expander. We've done lots of different modalities, and it takes time, but I wish, this is why I have these podcasts. I wish I would have had this knowledge with this little baby. I mean, he did breastfeed, but he was so colicky, went through all these behavioral things, and I kept asking and asking. Luckily, I'm very curious, and I ask a lot of questions, and the ones that don't resonate with me are the ones where I'm told like, oh, well, I
It's
personally, I've been
normal.
told so many things like take a antacid or take 800 milligrams. I'm like, what? No, like that doesn't get me to the why. So I've
No.
always been more on the, natural side. I'm not against the Western medicine, but it's just, it's just, knowing the root cause. And oftentimes it is breathing. So I love that you're a big advocate in that, and people can follow you, and you're always giving out great reels about that education wise. And now I wrote down so many things I want to dive with you, because I think this topic is so important as far as, thumb sucking and pacifiers. Like, what do you tell your patient? Because I know that's my son suck his two fingers, and gosh, I know that's why I could sympathize with parents. Was a dental hygienist, and I was like, yeah, I
Yeah,
know it is so hard to remove that, because it was kind of soothing his nervous system,
of course.
right? And
I was
finding,
a thumb sucker, so I know it as well.
yeah, me too. Me too, until very long. And luckily, I did have the braces, but that could be another conversation too about that.
Yeah.
But what would you recommend to parents where they're using pacifier, or their kids are, thumb suckers, and the long-term effects?
I kind of split this whole. I did a presentation in London a month ago now, probably, and I tried to split it into something really simple for us all to understand. And like, I feel like in my world anyway, there's 5 phases of biological dentistry. The first one is pre-infancy that we've already taught. The second one is the babies and the tethered oral tissues, and then the compensations and the habits, and we'll dive into that in a minute. And then if we've not done that as a baby, it's like what you're doing now, the myofunctional therapy, the correcting of the habits, the releasing of the tongue tie, and the expansion of the jaw skeletally if we didn't get it when we were young enough. And then as an adult, there's a few things. There's deburdening the adult body by removing all the stuff that's been put in as a result of all of this. I really truly believe it's as a result of all of this. And then looking for inflammation sources from the adult body as well. So deburdening is the materials, and then removing the inflammation sources is like kind of the failed root canals, dead teeth that are unknown, the cavitations from previous extraction sites that have not healed. So what I'm saying is it gets more complex. Oh, and then third is the adult airway stabilization, right? Because they're the deburdening of the adult body and the inflammation reduction are the two sections that's the dentistry that's been done that we have to undo to try and get them back to balance. But the airway stabilization for an adult is also important, because if you've done none of this as a kid, you've still got to do it as an adult, right? To help
Yeah.
you breathe better in deep sleep. So it's like it gets more compounding the older we get. So fixing it, like, and why you're so passionate, fixing it younger
Mhm.
prevents these children from having the issues that we've all had to deal with when we've gotten older.
Mhm.
So I ultimately say that dummies and pacifiers don't support. They soothe the nervous system for our kids, and they help us deal with life, right? Because it's
Mhm.
hard when they're not balanced. But what I've come to learn is that it's a compensation for not being able to self-soothe, and that normally means that they have a tongue tie. That's my experience.
Okay.
Because
That's good to
when
know.
your
So you're
tongue,
saying if they're having, you're trying to soothe and having a hard time soothing themselves, that usually tongue
yes,
tie. And that makes so much sense because my
yeah,
son had a tongue tie and he had a lot of problems trying to soothe himself and he had a two finger and, and just propels it. And so I
same
love
for
that
me
you
as
mentioned
well.
that.
I was the same. I was a thumb sucker up until about 8 years old. So if we notice these habits, we can replace them with things like myo munchies or myo chews, things that are going to promote the jaw growth and nasal breathing rather than hinder it. Because as soon as you've got a dummy or a pacifier in there, you're enabling the suck reflex, which pulls the cheeks in, which stops the palatal growth. And then you're also stopping the tongue from getting into the roof of the mouth, so you get a high vaulted palate as well, which affects the nasal breathing. So you're affecting quite a lot without knowing. And I was only breastfed for 3 months, and I have a very high roof of the mouth, and I was a thumb sucker afterwards. But as soon as that tongue can get into the roof of the mouth with the children, either by tongue tie release within the first couple of months of life or myofunctional therapy and tongue tie release later, the child will just drop off with any of their habits because their tongue self soothes for them. Because when you connect the nervous system from the tip, I think it's the vagus nerve, isn't it? Which is one of the muscles that innervates um, I think it's the glossopharyngeal that comes, glossopharyngeal is another, it's the vagus nerve, isn't it? I can't remember. It comes into the tongue somehow
Yes,
in
it
some of the
does. Yeah.
anatomy. Yeah, and when you get that nerve up to the roof of the mouth where the other nerves meet, even in Ayurveda, it calms the nervous system. They talk about it. But if you can't do that, you'll have to press on the roof of the mouth to help you innervate that nerve. So
Mhm.
it just connects the rest and digest nervous system, which is the only place that we can do it outside of the autonomic nervous system, which is why it's so important, right?
Yeah, that's why I always say it's the number one. You got to work on the nervous system. That's why I created the calm chair system because I see it day in, day out with a patient. If they're coming in late, first of all, they come on the chair and the first thing they feel is kind of anxious, right? They think about coming to the dentist 2 days prior and they're getting anxious and they sit there and I take the blood pressure. It's always really high primarily. And so working on the nervous system is number one. I truly feel, and the way that you're doing dentistry. And I love that you traveled all over and to seek education and that's kind of how hard you had to seek for that, but you saw the truth and you seek the truth even though it was out of status quo. And the way you provide this kind of dentistry in the UK, which is usually pretty behind when it comes to dentistry. I'm just honored that you're here sharing your wisdom because that is to educate patients and what you've learned, and you've had to work really hard, years of finding this information. Like I said, it's ever evolving. And so many people always ask me, well, why doesn't everybody practice this? How would you answer that? Why are I know I talk at dental conferences now and they're like, oh, you're the breath work girl. But no, I talk about the nervous system, trying to bring in the science to
Love
the
that.
logical
Yeah.
mind to
Yeah.
understand. And that's okay. Just like you, I'm like, it's okay. I quiet the noise and I know what I'm doing. And I know what I'm trying to bring this awareness because I saw the worst case scenario with my husband, what it does to the nervous system and how he got lost in the system where he went, okay, I'm in a lot of pain. I'm in this and that. Well, what are you given? Big pharma. Right. And so
Right.
it just spiraled. And so I honor what you're doing with the work. And how would you answer that? Why are more providers, dentists, not going this route?
Well, I think it's the education systems, isn't it, to
Mhm.
start with?
Yes.
Like, we're not taught this at dental school, and like you said at the beginning, we have to come through a place of hurt or like, what is going on? Why am I feeling this way? Why am I depressed? Why is my body out of balance? I mean, I was in my early 20s when my system was failing me after going to Bolivia and not being well because my immune system was so shot. And it was only because I met my other half and she was into the natural thing. It's like, you need to stop eating sugar, stop drinking alcohol. The sports you're doing is too intense for your nervous system. You're not giving yourself any recovery. And that was when I went to nutrition and therapists and gut
But you were
microbiome
open
testing,
to it though. At least
open
you
to
were
it.
open to it.
but only because I
Uh-huh.
tried my own way for a couple of years first and it wasn't working.
Okay.
But I was eventually open to it, so that's good, isn't it?
Yeah, because like you said, in education, you're kind of who's funding the educational programs for right? For medical schools is
Yeah, it's
pharmaceuticals, right? And so
yeah,
that's how I answer it. I said, well, who's funding the schooling? And that's what you're learning. And to unlearn something, like how hard is it for us as we do inner work to unlearn old patterns we were taught as a young age? It takes repetitiveness, keep asking questions and being curious. So I think for me having this podcast now, it's a small community of dentists. Once I know
yeah,
some that are
true.
biological and some that are not. And my whole thing is to educate even the general dentist to be open to move this way. And I love how you said, go shadow. I did the same when I decided to go. I was like, okay, become a naturopath, dental hygiene. And I remember shadowing as well. And a female dentist, she was encouraging me to become a dentist. And I was like, well, I don't know. you know,
Too much
too
effort.
much schooling. And I was like, I don't know. And so, but God aligned me in this profession for a reason. Now I see it very clearly why, and because I do truly feel is the most important place to look for overall health because breath is so important. That's why I
Oh,
tie in breath work at the same time. So for dentists to encourage them to go shadow, right?
mhm.
Go shadow a
Yeah,
biological dentist, go shadow and get curious. I mean, now when I'm in practice, I'll still temp general practitioners or biological, and I can see it myself. I can see the truth. Start educating yourself. Look at the margins. Look at around a root canal. Like I see this on a daily
mhm.
basis. I'm going to take the measurement, the perio measurements around there, and it's moderate bleeding
Deeper.
around a root canal, but everywhere else is okay. There's
Yeah,
less
and
bleeding.
that's
So you
because the
can't
bugs
unsee
can't
the
get out, right?
truth, right? So you
No.
start and the evolution of education, if we're going to wait for the governments and the schooling to change, that's going to take a really long time for them to catch up.
Yeah,
So it's more
agree.
supply and demand. So the more we educate, empower the patient to know which questions to ask, empower other dentists to get curious. And oftentimes it's not until they're really ill they're
Yeah.
really ill. Like so many dentists I've had on, it's because they've gone through their own journey of almost dying because of mercury
Mhm,
poisoning. And,
mhm.
or it was a loved one that they had done a root canal on and they couldn't unsee what they found. And so,
Yeah.
but why wait till then? Why wait? Right?
No, you don't need to.
There's enough evidence out there how important Airway is. I actually just called the dental office. I always call and interview them. And I'm so curious. I called dental office. I'm like, oh, do you have a CBCT scan? He's like, yeah, but I only use it for when, if the root canals or what was it, implant. Just
Mm,
probably checking. I was like, well, why don't you do it for every patient? They don't check the airway with it. I mean, imagine it's an expensive machine. Why don't you use it for
mhm.
what it can do, right? If
Yeah,
full and get it educated, and so I'm always just curious as to for you, your other colleagues that are biological, how they made the shift and where you're finding that resistance from other colleagues because there's a need, right? You're like you said, you're only one, and
yeah.
you're only one and can only take care of so many people, but it would have a ripple effect into families to care for children, care for adults. For their overall health, that if it can feel better, then it'll have a ripple effect for their entire family.
Oh, 100%. And I think it's a science. That's the holdback mostly, isn't it, for the research-led dentist, because there's no randomized double-blind control studies, but it's not going to be ethical to do these studies, and who's going to pay for the studies, right?
Yes.
So, but what we can do is the anecdotal evidence of all the patient testimonials and case studies that we see and hear. You can't argue with that stuff. And having worked in the NHS for 3 years before I went straight into this holistic biological space, is that I could see the shift. Just to put it in perspective, that our clinic, I don't know how many patients we got, 5,000 ish, maybe between 5 and 7,000.
Yeah, exactly.
And
One clinician. That's what I always say.
yeah,
Takes care. My husband took care of about 5,000 patients. So if we can work
yeah, it's
on the
crazy.
dentist to switch, that has a huge ripple effect of 5,000 to
Huge.
7,000 patient. Wow.
Yeah, absolutely. But what I notice now is being a fully biological clinic is that the level of medication that my patient's on is almost minimal. That tells you something, doesn't it? Like, whereas
Wow.
when I was working in the National Health Service, they would come in with sheets this
Oh,
long of
yeah, that's
medication to
all I
stop.
see too is a long list.
Yeah.
Yes.
So the patients that really take proactive healthcare into their own hands, practice breath work. And do you know what? I think you've got one of the most important jobs, because I'll just summarize this for the podcast, because I think, the breathing and the optimal deep sleep and the myofunctional therapy is the foundation of optimal recovery regeneration. But if we're as an adult and we've not got the burden of all this dentistry and all this failed dentistry that's within our mouths, it's the gums not being tight to the teeth that causes problems, right? Like you just said, like, because when I probe around root canals, the gums are open most of the time and they're leaking within the body. And we know now, even in conventional dentistry, there's no arguing that um, the microbiome imbalance and the bugs that are found within tumors now in the digestive system is directly from the mouth. And I think it's Porphyromonas gingivalis, isn't it? They found in the tumors. And then they've got in Alzheimer's as well, the
Yes.
plaques in the brain.
Yes.
And we know the respiratory system is directly impacted from the mouth breathing and the bugs that go in there, how many more people get pneumonia. And then also diabetes and all the cardiovascular disease as well. So,
Yes.
and why is that happening? Because the gums are open. It's like leaky gut, isn't it? Which was the
Mm.
fancy term last like 10 years ago. Now we're saying leaky gums are probably just as much important. And you get leaky gums from bad periodontal tissue connection, but also you could say, well, a root canal that's failed and has got bad bugs living in it and the gum's not attached to it is leaky gums, right? So that those endotoxins are going into the system as well. You can have a tooth that's been removed, but the body's not healed and it's got this inflammatory cascade, but still within the jawbone. That's also leaky gums, right? Because it's within the jawbone and it's leaking into the body. So I actually think that all of the inflammatory sources that come from the mouth are due to leaky gums or incorrect healing, and from dentistry that's failing. And one of the guys that I was speaking to runs a clinic in Portugal, Miguel Stanley. He calls it revision dentistry now, because it's not even biological dentistry. You're literally just revising in adults all the dentistry that's not been done or is failing now,
Yes.
and that's causing inflammation within that person. And like I said at the beginning, you don't know how much inflammation coming from the mouth is affecting the symptoms up here. So you
Yeah,
remove it down
exactly.
here.
And then the root cause of, disease, inflammation in body. I've done where
Yes.
biological age, and I always asked, I remember glycan age, I did it a test. I'm like, okay, well, what do you base it on?
Yeah.
Inflammation in the body. So it's so
Yeah.
important to reduce that inflammation. Now, I feel I could talk to you for a really long time, but I'd love to couple like case scenarios
Yeah.
that you have that really stands out that you could share. Because I know people love stories. And,
Yeah.
your cases that you're seeing and that you're seeing such a pivotal moment in their health.
There was a lady at the clinic that was testing she had kidney failure, and she was testing proteins in her urine, and she'd been under all the hospitals and everything. And I think our clinic removed two root canal teeth and did two cavitations on her. And after the first round, her proteins in the urine was less, and then after the cavitation surgery, it completely gone.
Wow.
No proteins in the urine. And that was a huge, because that's diagnostic data that someone's been doing for
Yes.
2 or 3 years. So you actually say, well, okay, what I'm doing is pretty crazy here. I've had patients with just a dead tooth in the mouth that's not even root canal. They didn't know it was dead tooth, and it had a massive abscess around it after doing a CBCT. So you wouldn't have picked it up otherwise if you're just doing intraoral bite wings, which are small X-rays. You wouldn't have seen that.
Yes.
And it was just a tooth that didn't look dead, right, from the top. No decay, no nothing. It's obviously an occlusal trauma or a younger tooth. Something happened. No, not even a filling in it. And it was on the lung meridian. So it's connected to the lung organ. And he had asthma and he had this anxiety like cough thing. And removed the tooth, put in a ceramic implant, healed, crown on it. He has no coughing, no anxiety attacks anymore. That was just from
Wow.
doing one surgery.
Wow. Wow. See, I love you sharing. Every dentist has their own way they're sharing this. And that's why my goal is to have all the biological dentists I learn something every time. And I know everyone listening is also, and there's proof that look in
Yeah.
the mouth first, but find the
Yes.
right practitioner. Unfortunately, it's not all the same. Someone that's going to be as knowledgeable as you, and that's why I have a lot of people that do fly out of, they
Yeah.
fly fly to you, fly all the way, Dr. Dom, they fly, I met Dr. Gandhi, and they have
Yeah.
people flying because it is hard, and it shouldn't be this hard to get this kind of care. But unfortunately, this is how it is right now. And
No, I was going to
so,
say
yeah, go ahead. Sorry.
basically that's like standing out in my mind that I think is hilarious because they're like the big surgical ones. The other one was the myofunctional therapy and the tongue tie release. So a guy that had sleep apnea, on a CPAP and did the myofunctional therapy, and his wife is like wearing the functional appliances at nighttime. No more snoring. Wife can sleep. They can sleep in the bed together, which is nice, right? The she doesn't have to sleep in separate rooms. And then we did the tongue tie release. Immediately he could touch his toes. Not been
Wow.
able to touch couldn't remember the because his hamstrings are so tight. So we released the tongue. He could touch his toes, and he could breathe really deep into his sinuses and into his diaphragm. And you could see his whole body just come down a notch and just relax. And I was like, wow. And he's like, this is just the most incredible. I think it might be on my Instagram somewhere. I don't know if I pinned it, but his
Oh,
tongue tie
that's
release
so good. I
journey.
see that with people with CPAP. Yeah, how that affects
Yeah,
their connection even with their loved one, because that machine is so
yeah,
loud. And actually, I noticed
hmm
that brings up my son too because of the tongue tie. We did
yeah,
chiropractic work and myofacial, and it was his left foot was just the way he walked. It changed all of that.
hmm
And then the pain he was getting and his foot pain. So it's all connected because of, with the tongue and how it affects the vagus nerve. So yes, this is so important. Number one, like you said, yes, removing all the toxins, but starting with breath, the nervous system, and airway. You're doing important work, and I am so grateful to have you on. And before we're done here, I'd love if there's one last thing you want to share, or how people can find you if they wanted to come work with you.
I mean, yeah. So I'm a clinical director of Wonder of Wellness, which is in the UK, north of England. We do have patients fly, but find the most local to you that has the same knowledge I have. It's always better, I think, to go to those areas. If you're wanting advice, I do online calls. I think I do like one or two a month where I have a whole day of just calls, just supporting people with their x-rays and their understanding of what's going on. And that could be booked through our website, wonderofwellness.co.uk. I run two online programs. One is called myofunctional for the kids to help them grow and develop properly and using functional appliances to help them breathe better and hopefully not need braces. Sometimes you need to, and I'll advise across the course, or expanders, sorry, and braces. And then I also do airway stabilization for adults, which is again myofunctional therapy and helping them breathe better so they can sleep deeper, so they can live a more vital life. And then, yeah, for me, it's just really the take home message, I guess I would say, is tongue ties or tethered oral tissues. One thing we didn't cover with the breastfeeding is lip ties matter in breastfeeding, because tongue ties is one thing, but if the lip cannot extend over the top of the nipple, you're going to get air into the digestive system, and you're going to get aphasia and colic and all those things that come with it. So definitely make sure if there's any sign of a lip tie and you're having a tongue tie release as a baby, ask them to do the lip as well, the top lip, most importantly. That's a really big take home message,
Okay.
because I've had several referrals, self referrals from patients now, where they've been to the National Health Service in the UK, they've had the tongue tie release done, but the baby's still got colic, still got aphasia. And then luckily the IBL CLCs are the guys that do all of the breastfeeding advice and know about tongue tie releases, have checked and found a lip tie and then referred for us to do it. And then within a couple of days, there's no more problems.
Wow.
So lip
Okay.
tie doesn't really have major consequences for growth development, but it does for breastfeeding. So that's a really
Okay. Good
important
to
point.
know.
And then just think about the phases. So if baby is releasing the tissues, osteopathy, craniosacral therapy, breastfeeding, good solid foods for growth and development. Child to teenager is about getting things right, expansion, myofunctional therapy, tongue tie release into the maximum genetic potential. Adults is still doing the same thing, but it's harder to do. The older we are, past 25, I'd say it's harder to expand. Then you're looking into more skeletal expansion things. And then it's about deburdening the adult body once you've stabilized the airway, which is getting rid of the materials that don't work in the mouth that could cause that. Because basically, biological dentistry is bespoke dentistry, right? You're doing dentistry, you're testing for things that work within your human body that your body's not reactive to. So removing all the stuff that is reactive to, and then trying to look at inflammation sources and trying to deburden the body from an inflammatory point of view as well.
Okay. I love that. That is very important information. And I am excited to share this episode with everyone. I'm always become your own advocate, get educated. And so thank you so much, Dr. Seb. I
Oh,
hope,
thank you.
I get to see you again, probably for maybe the
Yes,
Old Dentistry premiere,
I hope so.
right? Because you're in the documentary, right?
Yeah, yeah, working things out, but should be.
Okay, yeah, you should be.
But you're
Absolutely.
in it, right?
Yes, actually, I felt
Yeah,
when I met, that was a big draw to cons. Actually,
yes,
when I was invited, I was all for women empowering as far as Shield documentary. But when they
yes,
told me, here's our next documentary, I was like, oh, I have to be there because that
yes.
is my big mission now, is to shift the industry. And so I felt that my
Uh-huh.
story was also important because I'm also speaking for the provider. Well, I've got to be able to
Yeah.
the provider has to be sustainable, right? You have to also be aware of what's affecting your nervous system. Actually, I'd love to know what you do to sustain 5 to 7,000 patient base.
Mm,
I mean, that's a lot of energy that you take on, people with fear and anxiety and then pain. So you,
true.
as a healer, you want to take that on
Yeah,
for people, right?
yes,
And so I'm
yeah.
curious, what's your routine for your own mental health as a dentist?
Yeah, I mean, I'm not time rich at the moment because it's so busy and we're getting the clinic up and running and all new clinicians to support me. And how I've managed it for the last 3 years of getting this clinic up and running is knowing that I can't spend hours at the gym for my mental health and exercising, but I do something called the 4 minute workout every morning, which is like a nitric oxide dump is the other word for it, which keeps my cardiovascular system and lymphatic system moving. And it's basically squats, uh, jumping jacks, like over the head movements. And you're basically getting your body to Google it. You'll find it. Zach Bush talks about it quite a lot. And I do that every morning. And then I do a superset of a compound exercise. So I'll do like a bench press or deadlift or overhead press, um, squats, something that just it does one muscle group, but I'll superset it with another one. And so it takes me 15 minutes to exercise in the morning to make me feel good and feel like I've done something with my body. And then I'll do 5 to 10 minutes of meditation. And I will say like I've got a few little mantras that I cycle and say every single day. So words of affirmation for me, and depending on how I'm feeling. In the winter time, I'll do it in front of a UVB lamp, which is all vitamin D. Because in the UK we get 6 months of no vitamin D. So I'll do it in front of that and an infrared like big panel, like the red light things to get because it's pitch black. So I'll do that and in the summer I just go outside and sit in the sun and I'll be looking at the sun and doing that in the morning. And then I go to work and I love what I do. I think it's the most important thing. You have to love what you do in
Mhm.
life, don't you? And I love supporting
Yes.
patients. I love giving this knowledge, and
Yeah, it brings you
it
purpose, right?
brings.
The way you're treating them is very unique at this point, and it's so needed. So, yeah, having
So
purpose instead of before, like you had said, early
yes,
years was like, oh, for the paycheck, and
yes,
how
and that
that doesn't
provides
work for
nothing.
people, doesn't fulfill you. So, yeah.
No,
I
so
love
true.
that. I love everything that you're sharing. I know, me too. I lived in Alaska for 16 years. So yeah, having these
Mhm.
panels was so important, the vitamin D and K and
Yes,
so I'm always curious what dentists are doing because you are healers and you take on a lot. And so but we need you. We need you around. We
yes.
need you to not burn out and important to take care of yourself first to fill your own bucket before you go heal everybody else.
100%. And obviously, the foundation is food, nutrition, diet. Weston A. Price or Stephen Lynn's book, The Dental Diet, just covers all of those fat soluble vitamins and nutrients, your sauerkrauts, your prebiotics, your probiotics. And then supplementation is, magnesium for sure. I use Intelligence of Nature Biome, which is like this ancient soil that you mix it. I just put it in water and I drink it with each meal, and it's meant to hyper absorb the minerals that you're eating.
Oh, okay.
Um,
You'll have to
so
send
love
me
that
that
one.
link. I'm curious.
Yeah, that's Zach Bush's product. I love it, absolutely love it. And then I've been on this journey of root cause protocol. Have you heard of that one?
No.
It's like balancing your minerals within your system and copper, iron, magnesium, sodium. potassium. So done a lot of blood tests and functional work around that. Basically, you just have to treat your body like a well-tuned car that can only accept, especially when you're running at this much pace and putting this much energy into supporting people. So, and I found that my aura ring, I've got quite high HRV, which is heart rate variability anyway. I think my average is about 80. But since I've been doing this root cause protocol and balancing my minerals within my system, my HRV's jumped up 10 points. It's in its 90s now.
Okay.
So it gives me more functional energy, more focus. And I've been eating things like spleen from animals because it's higher in copper, because my copper was really low. So I'm trying to balance the minerals out, because basically what minerals do in the body is help your cells communicate. So it's like the electrolysis within water. If the minerals are out of balance, you're not making signals pass to the right places effectively. So I've been doing that for 3 months. It's been really
Wow,
interesting.
that's great. Yeah, I'm a big advocate to the biomarkers. I get my labs done every 6 months and seeing where I'm at. And it's been fun to see where, oh, I'm getting better. Like I've been taking nitric
Yeah.
oxide too and doing
Yeah.
the hyperbaric oxygen and seeing how these levels work. And
Right.
same with the minerals. I've been checking those too and using peptides as well to help with cellular health, which I've been really, I'm my own science project.
Yeah,
Yeah,
exactly. I think most
but
of us are, aren't we, really to this?
yeah, but give me the vitality. I have more energy than I ever did a decade ago,
Mhm.
and I feel great. And so there is something to it when you start the biomarkers and looking at your overall health and doing the work. It's instead of being daunting, oh, I have to work out, I have this. No, I get to, and I get to take care of this temple of mine, because then I could provide to others and heal others and have the energy to
100%.
do that. So thank you so much for being on today.
Welcome.
You're incredible. I'm deeply honored, and I can't wait to share all your knowledge.
Oh, thank you for doing what you're doing. And it was an honor to be here myself. So I appreciate you.
Thank you. Well, thank you for listening today on Not Alone. Today, I'm giving you a lot of education because I want to empower you with the power of knowledge, so you can make the right decision as a patient, as a healer yourself. If you're a practitioner, start educating yourself about biological dentistry, root cause, because the mouth is definitely the first place I think we need to look at when it comes to symptoms in our bodies and overall health. So thank you for listening. Please like, subscribe, and share with your loved ones.